If your baby has the likelihood to throw up or you see a lot of spitting up activity in your baby, you may want to put a little pillow under your baby's bed to raise the head of the bed a little bit so that your baby's food stays settled in their stomach. Hello and welcome back to Nurse Onyi Teaches. My name is Onyi. As you can tell by the title, I am going to be discussing some common conditions that newborns frequently present with. Now, before I get into today's video, I want to mention that no parent or caregiver should use this information to diagnose a baby. Rather, work with a doctor who knows your baby's information so that they can take care of the things that need taken care of at the time they need the care. If you have not done so already, make sure you hit the subscribe button and turn on your notification bell because that's how you know every time a new video is uploaded. Without further ado, let's get started. So the first thing we're going to discuss is cradle cap. Now, cradle cap is when your baby's scalp has scales or crusts that form in it. And these scales form usually because your baby has excessive oil being secreted onto their scalp around each of their hair follicles. It can also be caused by the hormones that mom passes on to her baby, especially if she's breastfeeding. Now, most babies begin to show signs of cradle cap when they're about 8 to 12 weeks old. And when they start showing these signs, it can persist until your baby is about 12 months old. So when you notice these things, make sure that you are a little patient because it can take a while for it to clear up, but it does clear up on its own for most babies. Now, some things that you can do to manage cradle cap include using a mild shampoo to wash your baby's hair every other day. If your baby has a lot of crusting on their scalp, you can use a little mineral oil or petroleum jelly, what we call Vaseline, to kind of soften up the crust and then remove the thicker layers before you wash your baby's hair. The one thing you don't want to do is apply oil to an already oily scalp because that's just going to make cradle cap worse. If you notice your baby's cradle cap is not going away, make sure you are talking to a healthcare provider who can diagnose your baby and then make recommendations for treatment as needed. Another thing that a lot of parents and caregivers will notice in their newborns and young babies is something known as breath holding, also called periodic breathing. In the newborn and in younger babies, it is typical for them to breathe about 30 to 60 times in a minute. But some babies will hold their breaths for about 10 seconds, and this is perfectly normal. After that 10-second period passes, your baby can take some fast and shallow breaths to sort of catch up on that period of brief not breathing. Now, like I said, this is normal as long as your baby is not showing any other signs of respiratory distress, such as grunting or gasping for air or turning blue. If your baby starts to turn blue, you want to get to emergency services as quickly as possible. If your baby is showing any signs of congestion or any kind of respiratory distress, get in contact with your doctor so that further evaluations can be done on the baby. Now, some things that you can do to manage your baby's airway include put in little drops of saline if your baby sounds congested so that you can help them thin out the drying and the crusting and the potential swelling that accompanies the newborn swelling that comes with irritation from the environmental factors. Another thing that a lot of newborns deal with is called acrocyanosis. Acrocyanosis is simply the bluish coloring of your baby's hands and fingers and their toes and their feet and sometimes around their mouths. It can be normal in the newborn stage, especially those first few hours after birth, as your baby's body is learning how to successfully send oxygenated blood all over your baby's body. Other times that this is also normal is after your baby has taken a bath or if your baby is cold. Now, this brief period of cyanosis should not last long. If you notice that your baby is staying blue for prolonged periods of time, you want to get your baby checked out. There may be some underlying health issue that needs to be addressed by the doctor, but if you know that your baby is cold or that your baby just came out of the bath, make sure you dress them warmly, get them in a warm environment, cover your baby up, and that acrocyanosis or the bluish color should quickly change back to being pink. Now, last but not least, a lot of babies tend to spit up or vomit during those early days. This can be caused by an immature digestive tract and weak stomach muscles that prevents food from staying in the stomach. Instead, the food comes churning back up into your baby's mouth. There are also some things that can make your baby more likely to spit up or vomit, and they include overstimulation after feeding your baby, allowing your baby to swallow a lot of air, overfeeding your baby, not burping your baby after baby has eaten, eaten, and also if your baby is allergic to whatever he or she is being fed. Some things that can be done to manage spitting up and throwing up in your baby include burping your baby before and after he or she feeds. Make sure that you are tilting the bottle if your baby is taking the bottle in such a way that more milk is flowing into your baby's mouth and less gas bubbles. If your baby starts showing signs of being full, stop feeding your baby. A lot of times overfeeding can cause vomiting. Also, make sure you don't overstimulate a baby that just ate. Make sure your baby has enough time to digest their food. If your baby has the likelihood to throw up or you see a lot of spitting up activity in your baby, you may want to put a little pillow under your baby's bed to raise the head of the bed a little bit so that your baby's food stays settled in their stomach. If your baby starts to forcefully vomit and you see it projecting out of their mouth, or you see blood mixed in with that throw up, make sure you let your baby's pediatrician know or take your baby to the hospital to be examined. There may be some digestive issues going on that may need further evaluation. Now, if you have learned something from the content of this video, do not fail to give it a huge like. Make sure you share this video with somebody who you believe can learn something from it. And don't fail to hit the subscribe button and turn on your notification bell. I wish you success as you navigate the parenting period of your life. And until the next video, be blessed.